Thank you for taking the time to view this video on Medicare Part B. This video is presented by Senior Pharmacist, a nonprofit organization located in Durham, North Carolina that provides free of charge Medicare counseling to Durham residents that are on Medicare or about to join Medicare. This video is one in a series of videos designed to provide you with information on the various parts of Medicare so you can understand what choices you have and make the best choices for yourself. As indicated in this slide, the information being provided in this presentation is general in nature. There are exceptions and special circumstances that may affect how this information may apply to you. When selecting Medicare plans, it is very important that you consider your own personal situation and make choices that are good for you. A counselor can help you navigate through the various Medicare options that are best for you. This slide shows an overview of the various parts of Medicare and the options you have in choosing how you want to obtain Medicare insurance. In general, there are two paths you can take to obtain Medicare insurance: Original Medicare on the left or Medicare Advantage on the right. The differences in the two paths will be covered in other videos. The key parts of Medicare are Part A, hospital coverage; Part B, medical coverage; Part C, Medicare Advantage; Part D, Medicare prescription coverage; and Medigap, Medicare supplemental coverage. This video covers Medicare Part B, medical coverage. Medicare Part B, usually called medical coverage, requires that you pay a monthly premium of $144.60. Medicare Part B typically covers 80% of the Medicare approved amount. Some procedures, such as wellness checks, diabetes screening, glaucoma tests, and flu shots, are considered by Medicare to be a preventive or screening service and are covered 100%. The following are examples of services covered under Part B. Doctor services, outpatient medical and surgical services and supplies, and preventive service, as mentioned before, which are covered at 100%. Mental health, both inpatient and outpatient services, clinical lab tests, and diabetes testing supplies. Durable medical equipment, such as oxygen equipment, hospital beds, wheelchairs, and walkers, ambulance services, clinical research, and limited outpatient prescription drugs. Let's talk about signing up for Medicare Part B. You must sign up for Part B except under special circumstances. If you are retired and you are receiving Social Security benefits, Social Security will automatically enroll you in Medicare Part B and send you a red, white, and blue Medicare card. Your Medicare card will identify the date your Part B benefits begin or the Part B effective date. If you had a Medicare card that showed you have Part A, you should receive a new card showing Parts A and B. If you are not receiving Social Security benefits, or you don't receive a Medicare card showing you have Part B, you must enroll in Part B. You can enroll in Part B by signing up at one of the following. You can enroll online using the link shown to connect with the Social Security website, or you can enroll by calling Social Security at 1-800-772-1213. You can also enroll in Part B by going to your local Social Security office. If you choose to go to the local Social Security office in Durham, I suggest you call to make an appointment ahead of time to avoid a long wait. The number for the Durham office is 888-759-3908. If you are still actively working after you turn 65, you have other things to consider. If you are receiving Social Security benefits, Social Security will send you a red, white, and blue Medicare card to show that you have been enrolled in Medicare Part A and Medicare Part B. It is important that you contact your employer's benefit office to find out if you need Medicare Part B at this time. If you don't need Part B at this time, you need to contact Social Security and tell them that you do not want Part B, so you do not have to pay the monthly premium of $144.60. If you are not receiving Social Security benefits and you have group health insurance with your employer, you need to do the following before signing up for Part B. Contact your employer's benefit office to find out if you need Medicare Part B at this time. If the benefits office says you don't need Part B now because you are being covered by an employee health plan, do not sign up for Part B. If you sign up for Part B and do not need it, you will be paying $144.60 a month for a service, Part B, that you cannot use. Additionally, you may also not have guaranteed access to a supplement or Medigap plan when you need it. Now let's talk about paying for Medicare Part B. As mentioned before, the monthly premium for Part B is $144.60 in 2020. If you are receiving Social Security benefits, the Part B premium will be deducted from your monthly Social Security check. If you are not receiving Social Security benefits, you will be sent a quarterly bill in advance of coverage. If you have a higher income, you may pay higher premiums called Income-Related Monthly Adjustment Amount, or IRMA. If you have a lower income, you may qualify for help in paying Part B premiums. If you do not sign up for Part B when you are eligible, you may have to pay a lifetime penalty. If you have to pay a penalty, Part B monthly premiums will go up 10% for each full 12-month period that you could have Medicare Part B but did not take it. The Part B deductible is $198 per year for 2020. This means you have to pay the first $198 before Medicare begins paying. The Part B coinsurance is 20% of the Medicare approved amount. For example, if the Medicare approved amount for a doctor's visit was $200, you would be responsible for paying 20% or $40. Here are a couple of other things to remember related to Part B costs. There is no out-of-pocket maximum for Part B costs. Without additional coverage, you are responsible for 20% of whatever bills you encounter. Many preventive services are free. You can find a list of all preventive services on the Medicare.gov website. There are many sources available to help you understand Medicare Part B and navigate the Medicare system. To set up a free appointment with a SHIP counselor, call Senior Pharmacist at 919-688-4772. To learn more about Senior Pharmacist and get access to additional videos and other material, visit their website at www.seniorpharmacist.org. You can also call the North Carolina SHIP office at 1-800-408-1212 to speak to a SHIP counselor. You can also visit the North Carolina SHIP website at the link shown on this slide. You can also visit the Medicare website at www.medicare.gov for more information. For more information on other parts of the Medicare system, please check out these other videos on the Senior Pharmacist website at www.seniorpharmacist.org. I hope you have found this video helpful. Please check out the others. Thank you for watching.